My name is Natasha Knowlton, and I'm a nursing student at Miles Community College. And in this video, we will be doing a piggyback IV. My daughter is my patient in this video, and
You still got the needle.
this is not a real IV. It's just a catheter taped to her wrist. So in doing a piggyback, you'll want to check your provider orders. You'll want to check DMAR and check your patient's allergies. That's a big thing, especially with medication. You'll want to do your 6 rights for your patient. So you're going to make sure you have your right patient, your right medication, right dose, right time, right route, and right documentation. You'll do your 2 identifiers for your patient. Can you tell me your name?
Mayana White.
Can you tell me your date of birth?
September 21st.
2014. So we've done our correct identification for our patient. We'll want to make sure we have our correct supplies. So you'll have a secondary line. We'll have our piggyback and the flush that we will be doing. You'll want to make sure your equipment and medication is not expired, is the big thing, and it's not tampered with and not opened. So if it's medication being prepared, such as an antibiotic, check your patient's weight and the medication that is being given to make sure you have the correct dosing. So after you've mixed it, you'll want to properly label your medication with the date and time and your initials and when it will be expired if there's any medication left over. So with her, you'll want to, of course, do proper hand hygiene and all safety protocols to make sure your hands are washed, you have your gloves on. Talk with your patient and identify what you are doing. You are giving them a medication. You'll also want, you need to go. You'll also want to double check with your patient's allergies to make sure that's correct. Lower the bed to a comfortable position for you and your patient, and you have all your supplies ready. You have your secondary line.
Really, another needle. Another IP.
No, be quiet.
Okay.
You'll want to label this line as well with the patient's name, the date and time, and your initials of when you did set your stuff up. Have your secondary medication. It's mixed and you have the right dosage for your patient. So in order to spike this line, you want to stay sterile as possible without touching anything.
Oh, that's a little one.
So once you have that on there, you do not want to waste any of this medication. So you will make sure it's locked and you will prime your medication. In there you are going to open this and make sure you get all the air out without wasting any medication, doing as very minimal as possible. And you will be hooking this up as a piggyback to your patient's other line.
Are you going to take that off?
What you'll do is have your stuff that's hanging. You're going to find your part.
my part.
And wipe that with alcohol to keep it sterile. You will apply your second line. So the secondary has to hang above the primary line. That would hang on your IV pole like this, and you can use this attachment comes with your secondary, and you would hang that on there like this. And also, if you have to,
Let's go bathroom.
And if you have to infuse medication into a line, you'll want to double check EMR for that. You want to check the medication, make sure your patient can take that medication. If weight is needed, you'll need to know your patient's. Mayana, stop. You'll need to know your patient's weight. So if this was being drawn up in a needle, you'd have your vial, and you would aspirate or inject the air you need. So for this infusion, we will be doing 5 milliliters. You want to check the infusion time, whether it's a slow push or needs to be infused over a minute or 5 minutes. When you are doing that, you want to check your patient's IV site to make sure it is still good. And explain to your patients, of course, your 6 rights, your patient identification. Everything is good with your patient's IV site. You have your right medication, your right dose, right time, right route, right medication, and also documentation as part of it. You'll alcohol swab the end of your port to keep sterile. You are going to hook your saline up, and you will push at whatever the provider's orders state. You want to make sure as you are doing your push that your patient isn't having any issues with the IV site. Ask them how they're feeling, if there's any burning or irritation. Once that push is complete, you'll want to check your site again to make sure everything is fine. You'll want to check your patient for any adverse effects that they may have. If everything is going well, you will put your patient back, their hospital bed back at a safe position, make sure they are safe, hand them the call light, and tell them to notify you if
What's a call light?
There's a button you push, and tell them to notify you if they need you, and you would clean up your mess, and you would document everything that you have done with your patient.